Awesome. Okay. Well, I will the plan, thank you all for coming here. This is great. The plan for me today was to
Too
oh,
late,
sorry.
like right this time, because the
Oh,
wind does most
um,
days. Now the
the plan
wind is
was for me to maybe talk a little bit about like runner's dystonia in general and like my experience with it and some of the treatment
out of
options.
your schedule.
And then kind of open it up to
Get
questions. Let me see. I
I
can.
think there's somebody who's not on mute.
Yeah, I think I got it. Okay, let's see. So yeah, if everyone, it looks like everyone's on mute now. Okay, can everyone hear me okay? Great. Okay, awesome. So yeah, I guess the tentative plan was I'll share my screen and then kind of show, talk a little bit about my experience with runner's dystonia, kind of what some treatment options are, and some, reasons to be hopeful. And then at the end, I will definitely leave out plenty of time for questions, because I definitely want to make sure everyone has questions that are answered. This will be recorded, so you can go back and watch it later. I can send you some of the slides that I'm working off of too, if anyone's interested, or if you have any questions about resources or anything else, you can email me for that as well. So if that's cool, I'm gonna go ahead and share my screen and we can get started. I'll talk for a little bit. So this is everyone here is part of the Runners Dystonia Facebook support group. Cool. Well, this is really cool to see everyone all in one place. I think sorry, one sec. Okay, can you see this? Hold on.
Yes.
Oh no.
Johnny.
Canva's the worst. Okay. If everyone can be muted. Okay, great. So let me check the chat here. Great. Okay, if everyone's on mute, then I'll get started. So my name is Lincoln. I'm a physical therapist at Re+active, which is in Los Angeles. We have two clinics. I'm in the Torrance clinic location, which is just a little bit south of LA. So my personal background, just really quick, is a physical therapist. When I graduated, I knew I wanted to do something neuro-related. I was a student at Re+active and I was really interested in dystonia especially. And Re+active at the time, I think it still has the only physical therapy movement disorders fellowship in the country, which is through Re+active and UCLA. So during my fellowship year, I was treating patients at Re+active, and I also once a week went to UCLA to shadow and learn from the movement disorders physicians there. And I was really interested, especially in the Botox clinic, because I got to see a lot of dystonia and I found kind of a passion for that there. I am a runner, so that's part of my specific interest in runner's dystonia, and that became kind of my niche in treatment. So I see a lot of people with dystonia, all different types, but I think runner's dystonia is probably my personal most passionate one. So I see a lot of patients with a lot of different movement disorders, but runner's dystonia is right now I'm seeing 3 runners at this time, and I can talk a little bit more about the program overall and what we do. But so that's my personal background. So it's not a diagnosis that I think you learn about typically in PT school or really in medical school either until you kind of do a movement disorders specialization there as a doctor as well. So I just found it really interesting and just rewarding that you can really help people who are struggling and who get back to the things that they like to do, especially running, but also even just walking a little bit better. So that's who I am. And then I know Bree, because I think Bree put this all together, because Bree was, I worked with Bree for a while when she came to Re+active for 4 weeks in October. Yeah, I guess October of the last year. Yeah. So Re+active, there's not a lot of clinics that treat runner's dystonia. I personally wanted to make it more of a thing at Re+active, even though it was already a place we saw it. So in January 2023, I became the dystonia program director. So my main mission besides treating patients is kind of growing the program. So talking to physicians, reaching out to patients and like support groups, and also just kind of doing educational sessions for other physical therapists as well, just to sort of spread the word to physicians, patients, and other PTs that there is something you can do about it. There is hope, and people can actually recover and get better and manage and even, really significantly improve their symptoms. So that's kind of our journey. And so primarily reactive, the way we treat dystonia based on kind of our overall evidence base of dystonia. There's not a lot of good research in runner's dystonia, but overall, we understand that for most types, a kind of team-based approach of PT, OT, psychology, yoga, lifestyle, those types of things all help because dystonia is a complex condition. So most of the people I see with runner's dystonia have a whole team. They come for anywhere from 2 to 8 weeks. 4 is probably the average. And we see them multiple times a week. And we're working on all different types of things, that are parts of those disciplines, which I can talk a little bit more about. So that's been really successful. And then I also see some clients that are just runner just for physical therapy as well. And that can also be successful for the right person. So my goal is to show you that there is hope for this, and there's treatment options besides just the botulinum toxin injections, which for some people can work really well. And for some people, they have not much benefit or not really no benefit. There's really no right or wrong answer. There's not a one size fits all. I think I have people who do great with both. Some do just one. But yeah, so then I'll just show you. I'm not going to talk for too long. I just wanted to show maybe some videos, some ideas of things we can do, and then answer a lot of questions. So I'll show a couple kind of videos of runner's dystonia clients in the past year. You're going to see a lot more that are running based. But so this was 1 4-week intensive client. So this was the start of the 4 weeks, just walking. So it's her left foot. And I tried to pick some examples that are pretty realistic. Like I don't want to just pick just the people who do amazing, but just to kind of show like from start to finish, what does like 4 weeks look like? And then what can it look like going beyond that time? So yeah, this person came for 4 weeks. She actually had less dystonia when she ran versus when she walked, which was really interesting. But so there's you can kind of see the way it turns out a little bit slower, a little bit chunkier. And yeah, so a little bit better. And then this was actually more recent. Just another kind of before and after walking video. So I think one of the key messages I'm going to share is just that there's a lot you can do in 4 weeks, but dystonia is complex and you're not going to just walk perfectly or even great all the time at the end of 4 weeks. It's an ongoing process. And so someone was excited. But so it's an ongoing process. And some of the time, even as you're making progress, it can still be really challenging. And that's just what dystonia is like. It's not something that we necessarily think of as being cured, but progress, that I try to emphasize this to everyone I work with, is progress is getting less dystonia less of the time. Maybe it's less intense, less frequent, and you can go for longer without the dystonia limiting you. So dystonia, I think I'm going to skip through a lot of the background of dystonia, but just to kind of get a brief overview of the sciencey stuff behind it, and then I'll show some more fun videos and stuff. So I think the key thing about how we understand dystonia, it's changed a lot in the last probably decade, which is that there's a lot of symptoms of runner's dystonia, especially that are not just the physical symptoms. And I think some people can do well, like I said, with just physical therapy, but there's a lot of things that we know because dystonia affects the brain is affected in this condition. So there, are sleep disturbances, psychiatric comorbidities for some people, fear of movement, anxiety, depression. Some of these things can be pre-existing and the dystonia can exacerbate it. So these are secondary effects, but also primary effects of the processes that are going on in the brain. So probably a lot of you have, I'm assuming, like people read a lot about it and you talk to a lot of people about it once you figure out what it is. But I think it's helpful just to have an overall analogy of what's going on in the brain. a lot of people have heard this, the software problem, right? If someone has a stroke, there's an area of tissue in the brain that's dead, disconnected, and it's just not working. In dystonia, it's more about a software problem. So there's the areas of the brain that process sensory processing and muscle control, and they connect differently for complicated reasons. We can't say for sure this is why you have it, but we know that it's complicated. We know there's many factors. It can be physical, neurological, environmental. There's a whole lot of things that put together can, in some people, result in dystonia. So some of the areas of the brain from studies we know that are affected, and I'm only showing this because it ties into treatment. We know that sensory processing is different, and in runner's dystonia, especially in the affected limb, so proprioception, the sense of where your body is in space on the affected side actually gets altered. And the longer you have it, the more those areas that connect to the parts of the brain that process sensory information, so motor areas and other sensory areas, they also start to connect in different ways. So you have these new connections that are unwanted forming, and all of the related connections in the brain become dysregulated. So it's sort of many areas all at once that lead to not being able to be entirely sure where your limb is in space. And then the motor areas that control it, you get a loss of inhibition, you get overexcitation, and it turns on when they're not supposed to be. The muscles that, for most people, is the plantar flexors, usually posterior tibialis, and sometimes the other calf muscles or flexor digitorum longus. So that is kind of the quick background science. But so what is the good news? If you think about it, I mentioned the analogy to a stroke earlier. People who have strokes and have, large areas of brain tissue that are actually infarcted and dead can have really dramatic changes in function. And you can regain strength. And that's with a whole, chunk of brain that's just not functional. So it makes sense that why would it be different in dystonia that you can't make changes? We know from research and just from experience that the brain is super adaptable. The brain is incredible, and it can learn bad things sometimes that you don't want it to, but it can unlearn them too. So that's where kind of our treatment approach comes in. And so, yeah, it's focused on mind and body. So I will maybe come back to this evidence part later, but I just want to show kind of our treatment and assessment pie chart for dystonia. So this is based on all the science that we know about areas of the nervous system that are affected in dystonia and the physical areas. And so we use these general categories, a pie chart, to figure out during our testing with everyone who comes in. So new person who comes in with runner's dystonia, we're going to look at all the physical stuff: mobility, nerve mobility, strength, balance, if they had past injuries that might be contributing, and then motor control. What sorts of fun kind of ways of cueing your brain can you get it to accomplish something that's more like the way you want your foot to move or your limb to move? And then lifestyle and psychosocial factors. I like the pie chart because it shows you that, like, for some people, all of these areas are going to be bigger or smaller. So for some people, it's very related to physical limitations. Maybe they had a lot of injuries in the past that affected their control and their mobility, and those might contribute more than some other people. Some people, it's very, psychosocial related. There are some people I've worked with where things really started clicking once they started, seeing a therapist and processing some trauma in their past. For some people, that's not really relevant. So we don't try to, force any sort of treatment on people that don't need it, but we look through the pie chart and sort of figure out what are the areas that we can address, because all of these things are potentially modifiable. And then this was just part of another presentation I did where I just gave people some ideas of things to do. So these are some of the things that probably look familiar to Bree that we sometimes start with, using an external cue. So external focus of attention. A lot of you guys might have heard that term before, but if not, just a brief review. In dystonia, the voluntary motor areas of the brain that control a specific voluntary action, for example, okay, lift my toes up when the dystonia wants to turn it down. that doesn't work as well because that's a voluntary motor action. And for dystonia, those tend to be more affected. What helps your brain to accomplish the movement that you're trying to retrain is to use an external cue. So for example, have a cup of rice taped on the top of your foot and try not to spill it. Well, you can only accomplish that by lifting your toes up. And for a lot of people, something like that can be a fun-ish way of learning to keep their toes up. And then variability. I think that's the other key theme I'll mention, which is that it's sort of like if any of you play a musical instrument, what's the best way to learn it, right? If you want to learn how to play piano, you're not just going to play, you know, for Elise for like 5 hours straight, because that's not going to really help you play piano. You might be able to play that part pretty well, but the brain works that way by doing better with variability and sort of blocked practice of different things. So picking a bunch of different exercises, once you have a ton of different exercises with your therapist, you can put them in a jar, pick one out, pick 2 or 3 out, and use that as your exercise circuit for the day. So you're helping keep it fresh for your brain to learn. If any of you guys want to stop me at any point, have questions or clarifications before I move on, let me know. So let's say you're coming in and I'm seeing a new person for runner's dystonia. You know, occupational therapy is going to be assessing some of these things. I mentioned a lot of the things that we're going to be assessing. And I'll just mention a couple things that we look at based on the science that we know about. So one is looking at sensory processing, which I mentioned. So this is 2-point discrimination, these calipers, and it basically looks at what's the smallest area between the 2 points where you can discriminate with your eyes closed that there are 2 points and it doesn't feel like one. So you can kind of try it on yourself if you have like kind of a sharp object or something or not. But basically, if you go in different parts of your body, you're going to have a smaller, more discriminate area of sensation. For example, your fingertips, you can tell that it's 2 distinct points at a very, very small diameter. On your thigh, it's a little bit less because less important. And so we can look at side to side on the affected leg versus the unaffected leg. Some people will have really dramatically different sensory processing. If that's the case, then we know, okay, we can do some sensory training, try some sensory inputs while this person is learning to walk, cycle, run, whatever it is. And that might be helpful for telling the brain a little bit more clearly where the limb is in space. We're going to look at balance. We're going to do sort of a gait analysis, figuring out what sort of movement compensations might be occurring because of the dystonia, or maybe we're contributing to developing it. You know, for example, some people will, if they've had it for long enough, start to do kind of weird things with their hip or their knee or even like their trunk. And sometimes those movement patterns they adopted in order to not trip or scuff their foot can actually be feeding into the pattern of the dystonia. So addressing sometimes the compensations can actually help them to move more normally in the future. Okay, so I talked a lot about the treatment staples already, and then maybe I can show, if it's okay, a couple cases from recently, in the past 6 months or so, that look at some running we did. I'll show some treatment videos as well. Okay. Okay. Sorry, one sec. Okay. So this was a case of an individual who came for 4 weeks, starting in, I think, September. So she'd had runner's dystonia for about a year. And it was, you know, mostly, you know, it obviously affected her ability to run quite a bit, but also was affecting her walking as well. And I remember talking to her physician who said, you know, like on the initial eval, she was kind of coming into the appointment in a wheelchair. So this was someone who had really enjoyed running. This is a big part of their life. I think that probably rings very true for a lot of people here. And so, you know, it's a very psychologically and emotionally damaging thing to be affected, you know, not be able to do something you really liked. But then also when it starts affecting your walking, there's just kind of no escape from it. So this was kind of on the first day looking at jogging. We were trying some kind of jogging in place and then doing forward and backwards to help make it a little more variable, but it was still pretty, let me make this bigger for you. but it was still, so this is left, kind of left foot here. Let's see, you can start at the beginning. But so pretty kind of slow, and you can see the foot kind of, the toes pointing down quite a bit, like pretty much right away as soon as we started. So we couldn't really do many steps at all without the dystonia really affecting it. So it really starts to go down after those first 10 seconds or so. So I'll show a lot of the treatment stuff that we did as well later on. But so just to show you, this is pretty typical in terms of how we can make progress. So this was week 3, and this run here was one of the first we did outside the clinic here. And this was, so punching forward was the cue, like imagining kind of boxing. So you can see like it's still, this was about as far as we could go without it being really interfering, but you can see it's starting to land a little bit flatter. You can see the coordination is a lot better. And then this was on the 4th week. So the first day we set our kind of running without dystonia was kind of one of the goals we measured. So our, running without dystonia causing, significant limitation was about like 30 seconds maximum, kind of regardless of the surface. A lot of people will do better on harder or softer surfaces at first. And so by the 4th week, we were up to, from 30 seconds, we're up to about 5 minutes on a harder surface, about 7 minutes on grass. So this was our first like long run on pavement, which was, I think for a lot of people can identify that's often challenging first. And there we go. So we can see, like, is it perfect? No, she was like, that's not how I like to run. But it starts to look a lot more like a normal running pattern. So we're getting the heel down more. And yeah, it was an exciting kind of first run. And then this was so this was in, I think, maybe end of February. So this person lives near enough by that we can do check-ins. So we've been doing once a month check-ins just to sort of see how's your exercise program going, how's implementing some of the other changes that we made, and are you able to keep making progress on your own? I think this is the most important thing I wanted to emphasize. Whether you go to reactive or not, whether you see a PT or not, when you do some sort of like intensive program or you see a physical therapist, you make progress, people always have the same anxiety, which is that, well, am I going to be able to continue this once I'm gone? I can run really good in the clinic, but I'm not going to be able to do this on my own. I think a lot of people can relate to that anxiety because I think every single person I've ever worked with has said that. And just to kind of show you guys that, yes, you can. Like this was just once a month checking in, and this was in February. And so this person got up to about a couple 2 to 3 miles on pavement in February. So week 4 of the program, that was in October. So now it's April, and she recently ran 7 miles on pavement and got it under 11 minutes per mile. So we were at about 12 doing her first mile. So 7 miles. So it shows, and she's doing, she does get Botox injections as well, but she's just continuing this, doing exercises on her own and kicking butt. So I'll show some of the kind of treatment videos that we did there. I mentioned a lot of the categories. So motor control, sensory, a lot of this stuff's going to look really goofy, but I guess that's why I showed the success video first, so it doesn't look as goofy. But so this was one, it's just a simple one that we can start with where we're just adding a dual task. So this one was just, sorry, pass the ball back and forth between your hands as you walk, and that can make it a little bit easier. So some people can bounce a ball, but you can just, so remember as the left foot, you just watch, like you can see the toes don't point down in that same kind of dystonic way nearly as bad with this sort of a cue. So there's a lot of different ways to do it. This was sort of a sensory intervention. There's a lot of overlap, but so this is a beanbag taped to her midfoot, which I think, yeah, she probably made the same face that a lot of you are making right now. It looks ridiculous. And also it really works. So we mentioned like the sensory processing is affected in the affected limb. Sometimes just adding more, sometimes it's vibration, sometimes it's weight. This is only like half a pound, but that just gave her brain a little bit more information about where her foot was in space. And that helped with having the toes kind of lift up more automatically. And so they're not doing the kind of typical dystonic pattern as much, just with a little bit more input there. Some more kind of external focus and also walking on grass. So a lot of times if you're trying to get back to running, maybe you can't run like at all. Usually the first place that people can walk and run better is a softer surface. So sometimes sand, sometimes grass. It gives a little bit more input and it's a little bit less nerve-wracking. So anytime you're stressed, typically the dystonia symptoms will be worse. If you're less worried about falling and hurting yourself, I think that's part of why the softer surfaces can work too. So this was trying to balance the ball on the racket without dropping it. So just having your brain focusing on the other task takes your mind off of the foot and it moves a little more easily. This one, I love this one. This, you can't really see it, but so she's holding an iPad that has a video of my feet walking on oh, I hate my videos, but this is my feet walking on the clinic surface. And so then you can see that she is watching that, and that can sometimes
Was it a wedding?
to take easier steps. This is an external focus on the treadmill.
Especially, yeah,
So
like your knee and hip.
basically just trying to kick the ball forward on the treadmill. Yeah, and so then, going back to from the like,
Yeah.
she's doing all the goofy stuff, but from week 1 with that to then, more recently in February, you can make a ton of progress. So, and I don't think that this is like an outlier case at all. I think she had a pretty standard kind of course of how things have gone so far, and she still knows where she wants to be. She wants to do long runs. She wants to do like a half marathon, longer runs like that. And I'm like, at this point, I don't see, we got up to 7 miles. I don't see why not. It takes some people longer. And some people go a little bit quicker with their recovery, but I don't think that anyone can't make progress. This was another recent one. So this was walk or running. This is our first attempt. Week 2, this is someone who hadn't been running at all, really for I think a couple years. And this was our first attempt recently in week 2. So it's left foot. Make it a little bigger. So first attempt on the treadmill, we're using a band there to try to give a little extra sensory input for her, kind of activating the glutes, seemed to provide a little bit less dystonia. And so the band is pulling back and she's pushing against the band. That gives a little more hip extension. So a lot of dystonia there, but still, this was a kind of a success to be able to run it all the first time. And then this one is week 4. And so, yeah, I put it in the thing there, but so it was, only got to 45 seconds. It was at 4.5 miles an hour. And then this was week 4, so only 2 weeks later. We got up to 5 minutes at 6 miles an hour. And yeah, a lot faster, a lot longer. I mean, that's one of the main ways of looking at it is like, she would say, and a lot of people would say like, yeah, I still feel it. And it's like, yeah, you do. It's only been 4 weeks and the dystonia is still there. But the point is just that if you have a little bit less dystonia, if you have 10% less dystonia week to week, and you can go a little bit longer, if you have a little bit less dystonia than you did the day before, your brain is getting closer to normal movement. And so it doesn't have to go from bad to perfect. You're still going to feel it a little bit, but you're going to have less every day and start to work towards the way you want to be running. If it's okay, I was going to show a few more kind of treatment videos and then maybe kind of open up to questions. Is that cool, Bree? Cool. Okay. So then I just wanted to show some other kind of, for the physical therapy things especially, what sort of things you might do. I don't want you guys to feel like you have to come to Re+active. And trust me, I've looked a lot. I wish there were more places that had like a comprehensive kind of dystonia program. I think a lot of people really benefit from that, especially in the intensive model. And, at the end of it, we give everyone a discharge summary from each discipline where it says, Here's all your exercises. Here's all the things we found that influence your nervous system in a positive way and help you manage your symptoms. I haven't really found any other clinics that have that. It's unfortunately pretty niche in the field of PT and also just healthcare. But I do think people have had success working with a physical therapist or, you know, a psychologist who's aware of dystonia and willing to learn about it. If you have a PT you really trust in your area and they're like, let me learn about dystonia and I'll help you, then you can absolutely make progress. And I've seen people do it. So I'm just going to give some more treatment ideas and I can give you more info if you guys want to share it, because anyone can do this as long as they're willing to learn. So this is motor control, sensory, autonomic, movement variability, and trying to get to some joyful movement. I think it's such a crushing experience, I think, for a lot of people to have this, and just trying to make it a little bit fun with your training. It can be goofy, but like you're getting proprioception here for your ankles. You can't really see it, but something called the Venom Go. It's this little vibration patch on her knee that was giving a little more input, as well as a TheraBand tied around the knee. So working on controlling that forward and back movement on the tilt board helps kind of re-establish that connection of knowing where your ankle is in space. This is another external cue. So have you ever seen those headband boxing ball things where the boxers are like doing this with the headband? So this was just holding that in front of the knee. So for some people, like thinking about moving their knee forward instead of moving their foot forward will give them a better cue. I already showed that one. So lots of external cues. Mirror therapy is definitely one that works for a lot of people, not everyone. And that's why we have sort of the pie chart in the system of breaking it down. But this can be helpful at retraining normal movement. So just showing your brain an image of, so this was where her right foot here was the affected one. She's watching her left foot unaffected in the mirror, having that visualization of the right foot, in quotes, moving normally can help the actual right foot hidden behind the mirror start to establish those connections, and it helps your brain plan that movement to look the way you want it to. This is a better picture of the Venom Go. So this was just adding some movement variability, kickboxing, and then this was the vibration right above the ankle. And that helped with dorsiflexion a little better here. And then we do lots of circuits. So we might do like a side shuffle, a backwards walk, a jump, things like that, where maybe as soon as someone starts walking more than about a few steps, their dystonia really kicks in. If you just trick the brain by giving them a ton of different types of movements to do, sometimes you can get a lot of reps of movement without dystonia. And that's the overall goal. Like I said, a little bit less dystonia every day, just trying to get a lot of reps of your foot moving more normally. So this was the rice, the cup with the rice in it. I'm trying not to spill it. So it's on the top of the foot here. And the goal is just, you can't really accomplish it if your toes point down, which is how most people's dystonia is. So that's what that is. This is just another external cue of keeping the leg moving straight forward instead of whipping out. So those are kind of the two patterns that I see the most is toes pointed down and in is probably the most common. And sometimes there will be sort of like a whip where the foot on the affected side will sort of whip out to the side. And then just a little more kind of movement variability with like a circuit type thing. Okay. I talked a lot. I guess those were kind of some of the treatment ideas I wanted to share. I talked a little bit about the program at Re+active and just kind of the treatment stuff that we do. Since I'm the dystonia program director, I also just keep data on the people who come through the program. So just the most recent one I just wanted to share, and then I'll just open up to questions. So I sort of look at the runners who come through the program, and we do something called the PSFS, where we'll ask them, what are your most limited activities? For a lot of people, running is number one. Sometimes it's cycling, walking, going to the grocery store, things like that. And we say, okay, from the start of if you had to say from 0 to 10, 0, I can't do it at all. 10, I can do it exactly how I want to. how confident are you at doing that task? They'll give a number out of 10, and then we average those, or we tally them up and add it out of 100. And so on average, people are at about a 2.7 out of 10 average for their specified goal activities at the end of the 4 weeks. So this is with 12 runners over the past year. Excuse me. 2.7 out of 10 at the end of 4 weeks. 5.8 was the average. So 58%. It's like, it shows that there's real progress, and also there's more to go. And I think I mentioned earlier, but the real important thing I want to mention is if you continue working on this stuff, even with just a little bit of guidance or on your own, you'll continue to make progress. It's not a trick. It's not like a mirage of being in the clinic and being at Re+active, even though it is great. You can continue to make progress. So 6 months afterwards, people are doing even better. So yeah, I guess that's the end of my planned things I wanted to talk about. I hope that just people feel empowered to know that there's options, to know that they can learn more about it. And there's a lot of things you can do, and you really can get better. And yeah, just empowered to kind of learn more about it. And yeah, I'm happy to answer any questions you guys have. Thanks for listening. Yeah.
Is it okay if I jump in with a kind of specific question?
Please, yeah, go ahead. I don't think there needs to be any like formal structure.
Well, because I'm currently like seeing an ortho physical therapist for
Yeah.
posterior tibial tendonitis, and
Mhm.
I'm experiencing. I'm not really sure if it's making my dystonia worse or not, but basically we have to strengthen that inversion motion, which is basically the same motion that the dystonia is causing. Like, do you have any like ideas, thoughts, tips on how to avoid that in recovering from that?
Yeah, so that's a really interesting one. I haven't seen that specific injury in this context. Often because most commonly, right, that tendon will get injured sort of from overstretch rather than like over contraction. So I haven't seen that specific case. However, I've seen a lot of people with kind of ankle soft tissue injuries that are, around with their dystonia. So I really think based on my experience, if you do your normal kind of tendon re-strengthening program, it's probably, I don't know how many, it might be, let's say, 3 sets of 10 reps or something, maybe daily. That number of repetitions in order to rehabilitate the tendon, it shouldn't be enough that it's going to significantly worsen your dystonia. I think probably if you're in a lot of pain from the tendon injury when you're running, that could maybe make you run more differently, and that might lead to other injuries or maybe the dystonia even worsening. I think it's a little bit theoretical, but my assumption would be that it's probably not anywhere near enough reps where you really need to worry about it, where you're going to make the tendon so strong it's making the dystonia way worse. I would try to rehabilitate the tendon the way your PT is helping you with. And if you're noticing it's getting significantly worse along the way, just maybe mention that and see what his thoughts are. But I don't think that would be the case.
That's really helpful, thank you.
Okay, yeah.
Because it honestly could just be me worrying that it's gonna make it worse because 'cause we're strengthening the same motion that's, like, making it
No,
worse, and just
it's
the
a totally
pain
valid
draws the
question.
attention there. So thank you, that's helpful.
Yeah, no problem. And maybe I can go into the chat for a couple of these questions. So yeah, do you see any success with patients who've had dystonia for many years? Yes, actually. So one of the more recent program participants I worked with, she had it for what's 2009? 15, I guess almost about 14 years, maybe running on 15 years. And she did awesome. She made a lot of progress in 4 weeks. I think it's really, really individual. So I mentioned before, like some people get better more quickly. They'll have more progress at the end of the 4 weeks versus some other people. And I think in general, if you've had it a little bit less time, usually you tend to get better a little bit more quickly. But this was definitely a case that sort of challenged that assumption for me. She got better just as quick as some people who've had it for about a year. So yeah, I think I haven't seen there be like a correlation where if you've had it for longer, like you won't get better. I definitely think there's been people have had it for 5+ years, 10+ years. She was the longest, but yeah, I do think that you can have success. It's definitely individual, depends on the severity, a lot of other factors. But I think those factors in terms of like the severity of it, how much it's affecting your activities currently, those things matter a lot more than just the amount of years, if that helps. Feel free to jump in if you have follow-ups to your question though. For Jeff, do we treat any patients online? I live in West Virginia. So because of the way that physical therapy licensing laws work, we can't treat patients virtually outside of the state of California unless you're licensed in another state. It's dumb, I think, but that's the law. So unfortunately, we can't do like telehealth if you're out of the state. What we can do though, and I've done this for some people, is if I mentioned before, maybe you have like an ortho PT or a neuro PT who isn't an expert in dystonia, but they're willing to learn. If you schedule it, we can do sort of a Zoom consultation where maybe we could be present on Zoom during a session that you work with your other therapist, and we can give some tips, or we could just, I could chat on the phone with the therapist who's in another state, give them some ideas, send them some exercise kind of options to do. And then, you could kind of work with them that way. There's also a lot of resources on, on our website. There's we have a dystonia video YouTube playlist. We have a lot of posts on Instagram, primarily is where we have the most posts of kind of treatment ideas that you could try if you're interested in sort of, working on it on your own. So having someone to help you can be good, but if you want to try it on your own, trying some of the online resources. There's also kind of a free dystonia webinar that I did that might have some other ideas that could be helpful as well if you're out of state. And then if you are out of state and you're kind of, on the fence, if you're thinking about coming to California, I'm, happy to do a free consultation and talk with you about what it might look like. I know it's a big commitment to come from out of state. Like I totally understand that. And again, like I really wish that there was more options I could just refer people to. I do have some neuro PTs that I know from our educational group that treat people with dystonia in certain states. There's not a lot, but if you have questions about if I know someone in your area, I can look that up for you and see if I could refer someone closer. Oh, good. Thank you for asking that, Robert. So actually, weirdly enough, yeah, we can do telehealth treatment in other countries, just not in other states. I don't know why. It doesn't make any sense, but yeah, if you are in Canada or you're in, I've worked with people in like India, Scotland, we can do telehealth sessions. And for runner's dystonia, actually, I feel like it's one of the diagnoses that probably works the best because, it doesn't really take that much space or that much equipment. And just, I'll just tell you, bring a beanbag and a tennis ball and something to put between your toes, like whatever types of things we found that are helpful. And then we can, do exercises on telehealth. So I've done that for people in California or other countries. For Kelly, dystonia started with cycling in 2017. Started working and yeah, great. Unable to cycling. Yeah, so I think that in general, if you're having a movement that the dystonia is getting worse with and continuing to do it makes it worse. For most people, taking a break from it is usually helpful. So if you're cycling and it's just getting worse and worse, taking a break usually is helpful. then starting to, but that's not it, right? Like if I was working with someone and this was their question, I would say, let's find some movements that you can do that don't bring it on. And then let's try to see if we can modify the movement of cycling in a way that you can do it without it bringing on the dystonia. And for some people that might just start with like visualized movement or watching a video of someone else's feet pedaling a bike. So you're activating those same brain areas, but you're not actually feeling the dystonia and training that pattern. Then we try, sometimes we'll do like going on your back and pedaling like you're riding a bike in that position. So changing position, changing sensor input, starting with small, short bouts. Those are often ways to start trying to get back into the movement without the dystonia, and slowly work your way back. So that's kind of like the general principle of it. In terms of, you can stop me if I'm going too fast. In terms of the cost, so do most insurance plans cover it under physical therapy treatment? It's pretty variable with different insurance plans, how much is covered, but most people do have some amount of coverage. In terms of the cost, it really depends on what disciplines you're doing, how long you're doing a treatment for, how many sessions you're doing, and what your insurance coverage is. So there's like a really big range. I would say that like if you're kind of interested in understanding what it might look like for you, you can give us a call or apply it on the Dystonia Re+active Dystonia page, and then you can get a pretty quick kind of estimate from our program admin, and set up a consultation with me or another therapist to talk about what sort of program might be good. Because for some people it could be pretty small cost if based on insurance. Some people it's a lot more. Okay. Any other questions?
I had a question on just as it relates to cycling. You know, I've done some physical therapist with a woman she's actually taken some of Julie's courses, but I was just wondering on the cycling side, do you do different types of activities than you do necessarily for running and walking?
Yeah, so it's a little bit like I was kind of answering to, I think it was Kelly's question. It's sort of the same principles where we're gonna start with limiting the movement that's causing a lot of dystonia, and then we're gonna slowly build back in movements that resemble cycling or are like cycling, like pedaling on your back, changing the sensory input. For some people, it's as simple as just altering the seat height or wearing different shoes, or putting a sensory input on the front of their shin, like the Venom Go, the vibration patch, or like a small ankle weight. There's different things for each person, but we're just changing the sensory input, changing the position, doing it for short durations, using visualized movement. The same way I showed you the person walking, looking at the iPad with the feet moving normally, you can do the same thing cycling, and I've done that before. You can also do mirror cycling, so you might use the unaffected leg and pedal in the mirror. So you're seeing the affected leg kind of move in the mirror like that. So it's really the same principles, but yeah, the activities are a little different that are going to be more specific to each task. I've worked with a swimmer who was the same. That was kind of a new challenge, but it's the same principles. We're just doing slightly different movements, but we're still altering the sensory input, gradually adding external cues and helping it build back into the activity. Does that answer your question?
Yeah, it does. I have a quick question though. Do you have
Yeah.
any good resources to find somebody actually cycling? Because I know, like, if I walk down the street and I watch somebody just walking, that's super beneficial for
Right.
me.
Yeah.
So I went online to try to find a cyclist and I could not find one. I
Yeah.
didn't know really where to look.
Yeah. So are you talking like, so, or how I've done it for most people is like an overhead video, like a POV. So like I mentioned, you're kind of like holding the iPad over your feet, and it looks like an overhead view of your feet pedaling. So I mean, I have a couple videos like that. But if it's more like just watching a video of someone pedaling on a bike, like from the side, I mean, maybe you could just try YouTube, like looking up like a cycling workout, like a Soul Cycle workout, or like a Peloton workout or something like that.
Yeah, I do a lot of Peloton stuff, but it doesn't really focus on the person's
Yeah,
foot,
Yeah.
so to speak.
I
So I
could,
was
I
trying
mean,
to find,
yeah.
yeah.
If you want, will you, maybe you can email me and I can send you, I have it somewhere. I have a video, like an overhead video of feet cycling. You could see if that worked for you.
That would be awesome. I'd appreciate that.
I don't think I put my
Alrighty.
email on here. I'll write it in the chat. Could you try?
Okay.
Yeah, no problem. Because yeah, cycling, I think, in my experience with the people I've worked with, it can get better just as well as the walking or running. Could you record a video of a spouse or friend to watch? Are you talking about like in theory, could you, or are you asking me? Oh yeah, right, yeah, got it. I understand now.
Oh, it's me.
Um,
This is Hetty. Yeah, I
Sorry,
could,
it's been a long day.
yeah, I
I
could have
understand now.
somebody.
Yeah, right. You can, so that's an easy one for people to do. Like I had one person I worked with, she runs with her husband and she videoed like his feet running from behind him. And then you could do the same thing with cycling too. For
Yeah,
sure.
that's not a bad idea. Yeah,
Yeah. I think
I
that'd be
could
a
do
great
that.
idea.
Okay. Yes, that is a good idea. Thanks.
Go Bree. Why do you, okay, so walking backwards and no dystonia symptoms. Yeah, so I think that in terms of like the exercises you're doing, we want to just slowly add more and more movements that are walking or close to walking where you don't have dystonia. So if you're walking in a straight line, maybe you get dystonia pretty quick. Walking backwards, maybe sort of like hopping or sideways walking, adding sort of those as exercises and drills throughout the day. Anything you can do where you're moving your legs and it doesn't have the dystonia, those are good exercises to add into a routine. So yeah, if walking backwards works for you, that can be a great exercise to do. For a lot of people, if they have symptoms right away when they start walking, we'll do little intervals where we'll walk forward for 10 steps because they can do that without dystonia. Then you walk backwards 10 steps and you continue that. So you're getting lots of reps of walking without dystonia. And you can gradually kind of build up to going longer. So yeah, it can totally be an exercise that you do but there are many. Why do I think yoga is helpful? Yeah, I mean, for a lot of people, I think there's different reasons. I think all the things you said are totally part of it. Balance, you are bringing awareness to the body, proprioception. Yeah, absolutely. I think there's also the component of just nervous system regulation. So we know in dystonia, people have a dysregulation of the autonomic nervous system that controls your level of arousal, your heart rate, blood pressure, the sympathetic tone, the fight or flight system. We know that is overactive in the nervous system of people with dystonia. It's part of the condition. And so for a lot of people, yoga is very relaxing and increases the parasympathetic, the restful, relaxed state in their nervous system. And that works really well for them to help calm down their symptoms. If you're more stressed, if you're tense in your whole body, then the dystonia is going to be where you notice it the most, right? So if you can get your body relaxed, for a lot of people, that's really helpful. Not everyone likes yoga. Some people think they don't like it and then they do like it. I'm really bad at it, but I would definitely give it a shot if I had dystonia. Yeah. Yeah, running or wearing an ankle weight. Yeah, totally. So you can running or using an ankle weight is totally something that some people do. Some people it's really light. I showed you the video of the person walking with just the beanbag, or like I've used a 1 pound weight kind of that was on like her midfoot, kind of taping that to the shoe. That's a good one, I think, for some people don't like doing that in public, but if you do it on the treadmill or something inside, that position of the weight, for whatever reason, that seems like that helps a lot of people know where their foot is. But yeah, that's definitely something you could do. What are some other ways to regulate your nervous system besides yoga? Yeah, so that's, I think one of the main things that our occupational therapists often work on, but we do it in physical therapy as well. So there's a lot of different things that work. We try to find the things that connect with people. So there's different breathing exercises, grounding exercises, for example, like I don't know if you guys have heard of the 5, 4, 3, 2, 1 grounding. So it's sort of noticing 5 things in your environment you can see, 4 things you can hear, 3 things you can smell, etc. 2 things you can feel. There's different grounding activities like that people often find helpful. There's like box breathing, that's like the inhale 3 seconds, hold 3 seconds, exhale 3 seconds. That works for some people, but yoga, sometimes it's just joyful activities. Sometimes it's things like coloring or doing art or, watching a movie with your kids. It really is person dependent, and I think that's why it helps to work with someone who really kind of wants to get to know the whole you and figure out, yeah, what regulates your nervous system, because it's not the same thing for everyone. I think one of the things that our yoga therapist does that is really great is that she's not at all rigid in terms of how she practices. She can do a lot more kind of higher intensity or much more kind of calm, restorative poses, depending on what helps people kind of connect with their body again.
Hey, Lincoln, can I
Yeah.
chime in on the yoga piece really quick?
Please, yeah.
I felt like I really learned when I went to Reactive, the difference between doing yoga and yoga therapy. That was very enlightening for me, and also highlighted like the integrative approach that Reactive takes. I do not like yoga, and so the idea of having to do like 60 minutes of yoga one-on-one was like, oh my gosh, like I tap out after 30 minutes. And I think what I realized when I learned the difference between just going to yoga and yoga therapy is that when you go to yoga, you come to a class and a teacher has a specific flow, a specific class in mind. They have an agenda, they have a plan they're going to teach. Whereas yoga therapy, you come to the session and we spent 10 to 15 minutes talking about what was I carrying for that day? What emotional baggage was I bringing to that session? What part of my body was sore? How did I sleep? Like, what were the variables that I was bringing to that session? And so some days it was more restorative, and some days it was more of a flow. Some days it was more of a stretch, depending on what my body and my brain needed. And then the piece that I would speak to how it kind of functioned into the integrative approach is, for me personally, a lot of what we were working on with like the counseling component was like perfectionism and trying to do things perfect and to be perfect. And I remember asking the yoga therapist once, like, this is one-on-one, how come you never correct my form and my posture and whatever? And she was like, Bree, the purpose of yoga, of this yoga therapy, is not to make you a perfect yoga student. It's really to connect your body and your breath and to calm your body and your nervous system down. That's what we're trying to do here. We're not trying to make you the best yoga student you can be. And that was really powerful for me to know and understand the purpose of it, but also that this yoga therapy is tailored to what you need on that day.
Yeah, that was beautifully said, Bree. I think that's totally on point. Yeah. There's a lot of aspects to dystonia, and for a lot of people, I think pretty much everyone I've worked with runners dystonia, there are certain like type A perfectionist traits that I think do tend to go along with it. And I mean, I think that self-selects, especially these are often people who run a lot or like competitively. That tends to select for a pretty kind of motivated, like very driven, repetitive, disciplined type of lifestyle. And often people have kind of very high stress jobs. That's not why you have dystonia, but it is part of it for a lot of people. And like we're not going to change your personality in 4 weeks or at all. Like and we don't need to, but we are just helping to figure out what are some things that you might be doing that maybe unintentionally are contributing, or what are things going on in your life that maybe you're not realizing are affecting your body in a certain way. So yeah, I think that was really well said. and I can't stop thinking about Roberta's question about free diving. That sounds so cool. Like I don't think there's any I don't think there's anything wrong with doing something that's challenging or maybe it makes you like temporarily anxious like that. I mean, that would make me anxious. But I don't think that there's that's not something that I think would really affect your dystonia in a long-term way. It's more like activities that are, really worsening your dystonia or something like that. So that, best of luck with that. I was just gonna ask then too, like, Bree, if you like had any other things you wanted to share or just, I mean, we can wrap up whenever, but if there was any other things you wanted to mention or ask, or if anyone had any questions that we didn't get to yet.
The only other thing that I was going to add just from like setting this up is like my experience with reactive was so powerful. And I remember when I came back, because I was documenting a lot of my journey on Instagram, I was getting a lot of questions through messages, and a lot of people were like saying, can you tell me exactly what you're doing, all of the exercises so that I can try to do them myself? And I tried to take that same approach with my PT, who is wonderful. And we were trying to do that, but there was something about the approach that you guys took with like seeing how my specific body responded to certain things. And there were certain exercises that we would try, like, oh, that worked for me, that didn't work for me, right? And I learned that I couldn't always trust myself and my body, because sometimes things felt weird to me or felt off, but it actually looked normal. And you guys would show me that like on a recording. So I had to learn that I couldn't always trust what my body or my brain was telling me. And I had to actually see it on video to believe it. And the other thing that I think that was really helpful for me, and there was a picture of it in your materials, but I don't think you talked about it, was the monitoring of the HRV, the heart rate variability with the leaf system, and putting that like sensor on every time I was in like the clinic to know what was improving or increasing my heart rate variability, like told you guys what things we needed to do. And so when we were trying to like regulate my nervous system, like knowing like box breathing or blowing bubbles, like we knew the specific activities that worked for me specifically, because we had data to support that it was working for me. And so that just like highlights some of the individuality and like customization of the work that you guys do when it comes to treatment. Like it's not just a shot in the dark, like you actually have things that communicate this is working or not working, etc.
Yeah. Yeah. Well, and so, yeah, I mean, I think like Bree said, I mean, the part of the dystonia is that, the sensory processing is different and your movements are different than they used to be. And so what you're feeling might not always correlate with exactly how it looks. And so sometimes people can get frustrated and kind of quit because they're like, well, I still feel it a lot. And, you can show them a video of like, well, this is what it looked like. And then you can see like, oh, yeah, I see it, but that's definitely less, right? And so I think it's really helpful to kind of have someone like a team to kind of help you through, like, it's okay to still feel it. You're gonna still feel it. You're gonna have days where you still have it, especially like after 4 weeks, like there's a lot of times where it's still gonna feel not perfect. And I think that that's kind of why I wanted to show some of the like longer term videos, just to show you like with the tools you can learn and with just continued practice, like you can keep making progress. This is a long-term recovery journey for everyone. Some people even longer than others, but like everyone can make progress and there really is hope. And like I said, I wish there was a lot more places I could just refer people. This is not supposed to be an ad for reactive alone, but just to show you guys, like I'm just really passionate about working with people with runner's dystonia. I think it's unfortunate that there's just not more people that know that you have options and hope to get better. And I really love it. I mean, it's just kind of my favorite thing to do. And I just want to have people feel empowered that there is options. And like I said, I'm happy to kind of help collaborate with other providers in any way that's possible. But yeah, I think it's like Bree said, it's, you know, you can watch these videos of what people are doing, and it doesn't necessarily mean that specific thing will work for you. Maybe it doesn't. But there's kind of treatment principles and categories that help you kind of stay on track. And so yeah, I appreciate Bree. Thank you very much for setting this up and you know, kind of being an ambassador. And I think you're awesome. You're really great to work with, and I hope that, you know, I can work with some of you in the future, or at least, you know, stay in touch and see if I can, you know, provide some sort of way to help you on your own individual journeys. So I'll stop sharing, and then maybe I'll stop recording too. But and then I'll just really quick about bracing. It's yeah, for some people it can work as like a sensory cue. For most people, they don't need a brace because it's usually not like, once you take the brace off, usually it's not getting you know, the dystonia hasn't gone away when the brace is on. It's sort of just so it's not necessarily, for some people it can help with pain and fatigue a little bit, like you said, but it's not usually something that's helpful in that sort of way. Let me give you the website real quick. The Instagram is just reactive reactive PT. This is the dystonia. This is our webpage for dystonia. So you can if you want to apply, there's also treatment videos and some of the resources I mentioned. So yeah, I thanks all for being here. It was fun to talk about it. It's my favorite thing to talk about. So appreciate it.
It's Courtney. I just wanted to say,
Hey,
it's nice to see you, and
yeah, good
thank
to see you too.
It's great to, having just been out at Reactive, I just want to share with everyone who's listening what a positive experience it was. So much hope, you know, and that's really what we all need. And I want to encourage people to explore Reactive if it's a possibility. So thank you.
Cool. Thanks, Courtney. All right.
This was awesome.
Yeah, thank you all. Okay, well, yeah, you have my email and website, so feel free to get in touch if you have other questions. All right.
Sounds good. Thanks for joining, everyone.
Yeah, thanks. Bye.
Bye.